nationwide mask requirement for public transit. That's according to the Associated Press. The order was set to expire on April 18th, but will now continue for 2 more weeks. AP says the extension will allow the agency to monitor the rise in COVID-19 cases.
Let's bring in Wish TV's medical expert and former Surgeon General, Dr. Jerome Adams. With this conversation, it's huge. Dr. Adams, let's go ahead and get your reaction to that decision that happened today.
Well, we know that this has been in place since February of last year, and it was designed to protect people on public transportation, on planes, which is what most people are talking about, but also on buses, on taxis, on trains. And we've seen cases go down. There's been a lot of conversation about relaxing that mask mandate. It was due to expire on April 18th, and the CDC has decided to extend it for another 2 weeks. And I actually think that's the right thing to do. We know that cases are starting to go back up in some places, 20% rise across the nation, 50% rise in places like Philadelphia. That's actually exponential growth at this point in time. We know it takes about 2 weeks for you to see cases turn into hospitalizations. So that gives CDC a little bit of time to collect the data and make an informed decision about whether to relax these mandates.
You understand this at a different level because you've had to make decisions like this, and you even got a chance to talk to some of the top leadership at the CDC. What did they tell you about this new guidance?
Well, I did. I reached out to some of the leadership at the CDC, and the answer that I got was, we want to get rid of this mask mandate as soon as it makes sense, as soon as it's possible, but now just didn't feel like the right time. And the reasons that they gave were, number one, we're coming off of spring break. Number two, we still have under 5 who are unable to be vaccinated. And number three, again, we know that if we give ourselves just 2 weeks, we will be able to collect more data and see if cases are continuing to increase, or if we've delinked cases from hospitalizations, and it's actually safer to relax that mask mandate. We know that once we get rid of them, we've seen it in the past, it's a whole lot harder to bring them back. So they chose to keep it on for 2 more weeks, collect the data, versus to get rid of it and then regret it in 2 weeks and then try to unring the bell.
Dr. Adams, what do you tell people who say, are 15 days really going to make a big difference? What do you think the CDC is hoping to learn in that time?
I think it's a fair question that people ask, and the honest answer is that we know that when we see cases go up, traditionally we've seen hospitalizations go up in about 2 weeks, and then we've seen deaths go up in about 4 weeks. We're hopeful that because so many people have now gotten vaccinated and boosted, most important lesson, get your vaccine, get your booster if you haven't gotten it yet, that we've seen a delinking, meaning that cases aren't necessarily correlating with hospitalizations to the extent that they were previously. If we continue to see that trend over the next 2 weeks, then that will give the CDC much more confidence to say, okay, we can get rid of these mandates. Another thing that could happen in the next 2 weeks is that under 5 could get approval for vaccinations, and then more people would be able to protect themselves. So those 2 variables, I think, are going to be big in terms of the CDC ultimately making an evidence-informed decision. I've given them a lot of flack in the past, but I think they're doing the right thing here. Better to go with 2 more weeks of discomfort and make an informed decision than to regret it based on making a hasty decision now.
Dr. Adams, thank you so much for your time.